Well, chances are you or someone you know has been sick lately, whether it's COVID, the flu, or a bad cold. It seems like there is a lot going around right now. We wanted to try and find out why that is the case and why this tridemic of illnesses, if you will, is particularly bad right now. Here's my conversation with Doctor Candace Bradshaw of Doctors Manitoba. Dr. Bradshaw, thank you for joining me.
Thanks for having me, Riley.
So first, I just want to ask broadly, what is circulating in Manitoba right now?
So right now we're seeing three main respiratory viruses circulating, those being COVID-19, RSV, and influenza. And these have been around for several weeks already in the fall, and there's really no sign of them going anywhere for the next several weeks of winter either.
So why does it seem so bad this year? It seems like everyone around us is getting sick, whether it be at the workplace, people in our families and schools. You know, we have these three viruses circulating. Why does it seem like everyone's getting sick at the moment?
So it is an unusual season where we've had this triple threat, which we haven't really seen before. And that can be due to a few things. I mean, everyone's been cooped up for a couple of years and had to put Christmas on pause, not once, but twice, things like that. So now this year, everybody's ready to go. Everyone wants to meet, socialize, gather in large groups, have parties, and that's totally understandable. So we're seeing more gatherings causing more infections. So there's one thing. Another thing would be, you know, for the last couple of years, there's very young children who weren't really exposed to RSV. And now they're coming up age 4 or 5 and seeing their first exposure of it, along with the usual cohort of 2 and 3-year-olds who are having their first exposure as well. So it's kind of a double whammy on that one as well. So, you know, it's winter. Everybody's gathering indoors. Nobody's outdoors that I know of, and poorly ventilated spaces. Not everybody's wearing a mask, and increasing wearing masks would help.
Yeah, and that sort of led me into my next question. What is your best advice for Manitobans over the next few weeks, even the next month or so?
So some good advice. We've already all heard these things, but it bears repeating. Make sure that you have a good fitting mask and wear them when you're in a poorly ventilated space. Wash, sanitize your hands as often as you can. Get your COVID booster if you're due for one, and get a flu shot. As well as, you know, stay home if you're sick. So a lot of people are kind of getting a little more relaxed on that one, but it matters, and infecting others is causing problems. So stay home if you're sick. Keep stocked with rapid antigen tests. Have them on hand so that if you need them, you've got a test to do right away. Keep a lot of masks on hand, and also have a plan so that you're not scurrying at the last minute trying to figure out what to do if you have a child or somebody in the house that has tested positive. So planning ahead can help ease the burden of what's going to happen.
So I know there's been a lot of gathering happening the last few weeks or so. Kids back in school again. Are you worried about what could happen in our hospitals, I guess, post New Year's, the first few weeks of the new year, I guess, once everyone's gatherings are kind of wrapped up?
Certainly. So, I mean, everybody's learned over the last couple of years how this all works. There's sort of that delayed reaction after there's a season of gathering. So a few weeks into January, we're going to see what the result of that is. So physicians are concerned not only about the health and well-being of Manitobans, but overwhelming hospitals. And, you know, we've all been hearing the stories of people having their surgeries delayed. And I'm certainly, as a family doctor, seeing it here, where I've had patients waiting 1 to 2 years with a lot of pain, needing a hip replacement, ending up on their surgery date with an IV in hand, being escorted out, saying you're not getting your surgery after all, because the hospitals are overwhelmed, the ICUs are packed, and the staff just aren't there, and the spaces aren't there to put new patients that need new care coming into the hospital. So everyone's already committed looking after the more critical patients, and there needs to be some catch up. So we are concerned. 96% of our physicians, when we polled them recently, were very, very concerned about hospitals being overwhelmed.
So when should you, if you're not feeling well, for example, maybe not the easiest one to answer, but when should you see a doctor? When should you go to the ER?
I would say you would want to see a doctor if you've had a fever for over a couple of days, you're not sure why, your COVID test is negative, you're feeling really unwell. So a fever 38.0 or higher usually, give it at least a couple of days, especially if you're short of breath or you're having chest pain, or you're in pain that you can't explain and you can't control with some simple over-the-counter medications like Tylenol or Advil. Go ahead and get yourself seen. Sometimes it doesn't have to necessarily mean a trip to urgent care or emergency. It can just mean a phone call to HealthLinks, or for example, our clinic has a nurse that can be called for our patients to run things by. So there are other things you can do rather than just showing up and needing an appointment.
I want to end maybe a bit optimistic. Is there any end in sight to this? Like, are we over the hill yet?
Hey, look at the difference even 12 months ago from now, and especially 24 months ago. We have come a long way, and people are finally enjoying life again. And that is so nice to see. And we need that. We need to. So there is lots of hope, lots of positive on the horizon.
All right. Dr. Bradshaw, thank you for your time today. I really appreciate it.
Thank you very much.